All right, welcome to the Backyard Farming Small Ruminant series. This session is Lamb and Kid 911. My name is Megan Purdue. I'm the agent associate in Worcester County, Maryland. All right, we are at Equal Opportunity University. We have a disclaimer, as in all of these, because we do get into the weeds with some medical advice, some stuff that you can use, but the advice in this presentation does not represent medical, veterinarian, or legal advice. Always seek a competent veterinarian advice when possible. If we use a website, product, or a brand, it's not an endorsement. A lot of products are regionally based, so the examples that we provide are just examples that are available in our area. It is essential to have a veterinarian in the event of an emergency, and I cannot stress that enough. That is the main purpose of these 911 series sessions, is to get you prepared to have a vet and also how to properly use a veterinarian. This presentation is going to cover some of the common problems that you may encounter with very young kids and lambs. It's not going to cover everything. Sometimes you may be that unfortunate person who gets the oddball disease or illness or event. Many of these diseases can be prevented with good management. So that's another reason why we have them, is so that you can avoid serious health problems by good management. So to start off, we're going to talk a little bit about medications. I'm going to give you a couple of details about medications to stress the importance of having that relationship with your veterinarian specifically. Most of the available effective medications and dewormers are not labeled for goats and or sheep. If you use these items on goats or sheep, it is considered off-label. It's technically illegal to use medications. That includes antibiotics, anti-inflammatories, anthelmintics, all common things that we would use on sheep and goats, off-label unless it's under the direction of a veterinarian. And a valid veterinary client-patient relationship is necessary for a veterinarian to give you medical advice. Don't go on social media and trash a vet because you called them up and you're not a client and they wouldn't talk to you about your situation. Technically, they need to have that relationship with you in order to be giving you medical advice. Another thing that veterinarians can do, because stuff is not always labeled for sheep and goats, they can give guidance on withdrawal periods for those medications when you give them to your sheep and goats. That's something that you might not have access to because it's not going to be on the back of that bottle. So we'll talk a little bit about veterinarians. You need to establish a relationship with a veterinarian before you need it. Large animal veterinarians are usually in short supply in most areas. Usually they have a very full client list. So they're not going to answer your calls a lot of times if you are not a client of them and you're calling with an emergency. They just don't have the time. They're very busy. It's a stressful job. Antibiotics are prescription now. A couple years ago, you could go buy penicillin, you could buy oxytetracycline at your local farm store. If you happen to find some that are not, you've probably found an old batch that were not labeled RX, but in this area, I've not seen any since shortly after they went prescription only. A good thing to know would be where the closest large animal emergency hospital is. I have one about 2.5 to 3 hours away from me. That is a viable option in an emergency, whether you have a veterinarian or not. Sometimes it is in your best interest to pack up and take them to the emergency hospital. Just depends on what type of emergency you are dealing with, and how far away your vet is. They could already be at an emergency where they can't be in 2 places at one time. So that is an option for some people. I realize that might not be an option for everybody, but it's something worth investigating when you have livestock. It's not going to be cheap by any means, but an emergency call from your vet might not be either. The purpose of this presentation is to allow you to recognize the problems more quickly so you can contact your veterinarian in a more timely manner. In many situations, even if you start treatment, it is crucial to follow up with your veterinarian in a timely manner. Sometimes you can start, but there's other treatments that need to happen. Your veterinarian might tell you what you can do before they get to you. Time is of the essence in some situations. All right, so one problem that you may encounter, and you'll probably, if you're raising lambs and kids and you're having babies born on your farm, you're probably going to see this. And the reason it's not usually an emergency, but the reason I put it in there is because not everybody knows what it is. And some people think that that's diarrhea. Some people think it's an emergency. I'm going to call it pasty butt because that's what we call it in chicks. In chicks, it's more of an emergency. This is something where the poop just gets hung up under the tail of a lamb or a kid. It's usually very sticky. It can get very nasty and it can grow into a monster ball, which could become an emergency. But this usually happens in the first few days to very well-fed kids or lambs. So if you have a dam that is producing really well and the baby's eating really well, this can happen. It's a great sign that it's eating well. It's just you're going to have to, if she doesn't clean it up, then you're going to have to clean it up. It can build up and block the anus. Sometimes it'll fall off on its own. Sometimes it continues to grow. If you see it growing, then you need to intervene and clean it up. If it's still sticky, you can use a baby wipe or a warm washcloth. I have had situations where I've had to shave the hair because it was so stuck to the hair. Very carefully shave the hair because it's delicate skin on our lambs and kids at that age. But I've had to shave the hair off to get it to release. I've had to soak the fecal ball at one point. You want to be careful not to pull the skin. It's going to hurt if you pull the skin. It could tear the skin. The longer you wait, that harder that feces is going to get, and the harder it's going to be to get it off. Usually it stops happening after the first few days. Their poop's going to get a little bit more solid, might start forming little teeny pellets or little teeny clumps, and it's not going to be as sticky. So along that lines, there's what we call scours, and that's going to be diarrhea. You'll see in the picture that is normal kid feces. I've seen people panic because it's yellow, but they're drinking milk. So that is normal. As they start eating other stuff, the feces becomes darker, but that normal clumpy yellow poop is normal for a young lamb or kid that's drinking milk. As opposed to scours, which is a watery diarrhea. Sometimes with scours, it's not going to be a normal color. It may have a foul odor. I've had bottle babies where I opened up the door and I immediately knew somebody had diarrhea based on the smell. Not that their poop smells good to begin with, but it was a very different, very sour, different smell. You could call scours anything other than normal feces would be a scouring. Again, normal lamb and kid feces is yellow once the meconium passes. So that first poop after they're born and they start to eat is going to be that black, thick, tarry stool, that meconium stool. Once that passes, it's going to turn yellow. It's going to stay yellow again until they start eating something other than milk. It may get clumpy and sticky, but then it usually changes to little yellow pellets. One of the problems with scours is usually they're going to get dehydrated with it. And a lot of times when a lamb or a kid is scouring, they're going to be very droopy, stand in that arched back presentation, which tells you that they're sick. They can get depressed, and usually they're going to have a decreased appetite or no appetite at all, just depending on what causes it. So some of the things that can cause it will be feed changes. It's very common in bottle babies. If there's inconsistent mixing of the milk replacer, or you've increased the amount too quickly, maybe somebody else fed, maybe they stole another bottle after they finished theirs. Overeating can cause it. So if you have singles or a high production in the dam, then the baby may overeat. There's also bacterial scours, like caused by salmonella. This is more common in older lambs and kids, or E. coli. That's more common that first week. Coccidiosis can also cause them to scour, and then diseases like Clostridium perfringens type diseases can cause them to scour. When we're treating scours, remember, diarrhea is a symptom. So you want to identify the problem if at all possible. The stuff that we use to treat scours is actually treating the symptoms to prevent dehydration. So you're just stopping that diarrhea, trying to stop that diarrhea so that they don't dehydrate. You're not necessarily treating the problem. So you want to treat that cause whenever possible if you can figure it out. Again, diarrhea is a symptom that means that digestion is not happening properly. When an animal is having diarrhea, they're going to get dehydrated, especially these younger lambs and kids, and they're going to lose nutrition. So there, if a scouring is caused by nutrition, again, bottle babies, if they exhibit diarrhea, depression, or and are reluctant to eat, you probably should pull them off of the milk, stop trying to feed them milk and feed them electrolytes instead of milk for 24 hours. That's the recommendation. And then gradually reintroduce that milk. Think of it like if you've had a dog that's had severe diarrhea and the vet tells you to get them on chicken and rice, because that's a much more bland diet. And then you gradually put their kibble back in, reintroduce their kibble. Um, think of it kind of along that lines. You want to you want to heal that gut and then get it used to food, the real food again. You may need to give them B complex. Kale and pectin is a good treatment. And then make sure that your milk is getting mixed properly. If you've allowed your children to mix it, maybe that's not a good idea. Somebody who is very particular about mixing probably needs to be mixing the milk and make sure it's consistent, as we talked about last week. Lambs and kids that are nursing their dams can be treated with the kale and pectin. If you're not familiar with that, that's basically the pink stuff that you would take for diarrhea yourself. Basically, it's the same thing. It is pink. Has a very sweet smell to it, but it is good for treatment of diarrhea, especially if it's a nutrition type diarrhea. Again, you're treating symptoms. You're not treating the disease with that. If they're dehydrated, you're going to need electrolytes and probably some B complex. Bacterial scours are going to be a little bit different. You're going to see diarrhea. You're going to likely see them depressed, standing with that arched back presentation. They may have a fever or a below normal temperature and a loss of appetite. Again, with treatment, you can treat the symptoms with the kale and pectin, oral antibiotics in this case, because it is bacterial. Vitamins are recommended, and then treatment for dehydration, especially if they're not eating. Coccidiosis is something you're going to find usually in older lambs and kids, generally speaking, over 30 days of age. Coccidiosis can be brought on by stress. So sometimes you see it at weaning. If you have a problem with coccidia on your farm, it might be a situation where you find that they're getting it at weaning. You want to treat that with oral coccidiostats and vitamins. For some medications, you should have thiamine on hand in case they end up with a deficiency. I think sometimes we overdo the thiamine, and people are given it with certain medications before it's needed. In any case, I would always have B complex on hand because at some point you're probably going to need it. Feeding coccidiostats in late pregnancy for your dams can lower the oocytes in the environment, so that your lambs and kids are less likely to pick it up. And remember, those oocytes will thrive in warm, moist environments. So the Mid-Atlantic, we're great at growing parasites and coccidia and all the things that we don't like. Then there's Clostridium perfringens, which types B and C is what we're talking about. You might know this as CD and T. So you're probably familiar if you've been raising sheep and goats for any length of time. You've probably heard of the CD and T vaccine. That is a Clostridium vaccine and includes tetanus. But the types B and C, they occur in young lambs and kids. The symptoms you'll see is watery, foul-smelling diarrhea. It may have blood in it. And usually there's going to be abdominal pain with this one. That's what's probably going to clue you in that you're dealing with something a lot more severe than your typical diarrhea. The treatment usually doesn't work. I won't say don't try it. I actually experienced this for the first time ever about 13 months ago with a bottle baby. And it was because I did not wean her. And as Susan Shaning would say, you're killing them with kindness, because I left her on the bottle too long, and she was fine one minute and the next minute she was not, and she probably would have died if she hadn't still been in the house, which I don't recommend either. but I didn't have a friend for her outside. So she stayed in the house. We had just gone back to do lamb checks. She was one that I bought for a pageant around Christmas. And since she fits in with my herd, I decided to keep her. And we'd gone down she followed me down to the barn to check on my sheep um, because it was lambing season. And she was fine. She'd taken her last bottle for the night. I came up and she started jumping on stuff and jumping off. She laid down. She started kicking. Her belly was in severe pain. Um, and that's what clued me in that it was something very serious. She wasn't bloated, but she was in massive amounts of pain. Um, Unfortunately, I did not have all of the treatment protocols for her. Fortunately, I had some of them, and I started her on what I had. And she was the pain medicine was crucial for her. I got antibiotics into her. I was able to get um, at least most of the things in there. I did not have antitoxin, but I also caught it. I don't think she would have been alive if I caught it an hour later than when I caught it. So she did pull through. So I do recommend, even if the prognosis is poor, I would still try to treat. It was a very long night for us and a very long day the next day. She was doing better, but you could tell she had gone through a major trauma. But she did pull through it and she's healthy today. But so I always, do what you can. Um, if it doesn't work, it probably wasn't going to work anyways, but if you never know if you don't try. So the ideal treatment for this one's going to be C&D antitoxin. That's kind of expensive and sometimes hard to get your hands on. You want to give antibiotics, vitamins and electrolytes are recommended. But the pain medicine is also going to be good because there is severe abdominal pain with this one. So the best thing you can do is prevent scours of any kind. So make sure your milk replacer is consistently and properly mixed. Avoid sudden feed changes. Avoid stressing babies. Don't overfeed them. Vaccinate your ewes and does. Vaccinate your kids and lambs at the appropriate age. Sanitation, so clean environment. Don't overcrowd your pens. Don't overcrowd your barns. And keep your feeding equipment clean. The next one that you might encounter is joint or navel ill. And this is an infection caused by bacteria entering through the umbilical cord. In the picture, that cute picture is there because the kid that is laying on the lamb had severe joint ill. And I mistook it for a broken leg. I thought her mother stepped on her. I brought her in, put her on a bottle, splinted the leg. Then the next day, another leg was looking like she was acting like the other leg was broke. I felt it. I'm like, oh, you have joint ill, and started treatment on her. She did fine. But you got to be careful. It's not always, it looked like I thought she had a mild broken leg is what I thought, but it turned out she had joint ill. It's going to generally occur in young lambs and kids. Usually you're going to see it around a week old. I have heard of older lambs and kids being diagnosed with this. For older lambs and kids, you want to rule out mycoplasma as a cause of it. And if you have an older lamb or kid, like a 30-day older lamb or kid, I would get the vet to take a look at it and make sure that it is what you think it is. The symptoms are usually you might see a fever. You're going to see, if it's joint ill presentation, you're going to see lameness in one or more joints. They may be hot or swollen. The animal's usually going to be reluctant to move. And then if it's the navel ill presentation, you might find a swollen, painful umbilicus. The treatment for this one's going to be broad spectrum antibiotics such as LA200 or Thailand 200. Your veterinarian's probably going to want you to treat the animal for a longer period of time than what the directions are on those antibiotics. And the choice of antibiotic may depend on the bacteria. Pain medication and anti-inflammatories would be helpful. For prevention, you want to clip and dip umbilical cords as soon as possible after birth. Strong iodine is preferred. A lot of the commercial dips and sprays that are marketed for umbilical dips can also help dry the cord out. So it's less likely that the bacteria can get up in there. The pictures are a couple of different options. Some are better than others. So when you're looking at the iodines, your triodine's usually going to be more preferable. But if you had like just a betadine, something's better than nothing. And you want to make sure that you get the whole umbilical cord. So if you do clip the umbilical cord and make it shorter, it's going to be easier to treat the whole area. Make sure you treat the whole umbilical cord. I like to make sure I have a solid circle around the base of the umbilical cord too. The umbilical spray down there, I really liked that one, but I don't know that that's even available anymore. I've had to go to a different commercial umbilical spray that is available. If I've heard of people having resistance issues to iodine products, if that is the case, then pick something that the active ingredient is different, maybe a chlorhexidine based spray instead. You want to keep your lambing and kidding areas clean and make sure that your newborns get colostrum. Colostrum is good for everything. So make sure that they are getting adequate colostrum as soon as possible after birth. Another thing you may encounter, especially on days like today in my area, if they are lambing or kidding, are chilled lambs or kids. And this is going to be more related to newborns as opposed to older lambs or kids. This usually occurs in very young animals that aren't getting enough to eat. Usually there is a feeding, even when they get older. A lot of times the reason they stay chilled in the colder weather is because they're just not eating enough. The symptoms for this one are anything below normal body temperature. So if it's 100 degrees Fahrenheit or below, it's considered hypothermia. If it's 99 degrees Fahrenheit or below, it's considered severe hypothermia. That's going to be important later. You may notice that they are standing hunched. Again, on a cold day like today is here, the wind's blowing, it was in the teens for wind chill. You're going to see a lot more animals standing hunched on days like today. But when in doubt, pick them up, stick your finger in their mouth, make sure that it's warm. If it's cold, try to get them to eat something. You may notice babies going out and just crying, having that little starvation cry, that weak cry. Or you may notice them sleeping curled up a lot, especially as their blood sugar starts to drop. They're going to be sleeping more. They're going to stay curled up. One of my old bottle baby lambs from years ago, she was a triplet, wouldn't take a bottle to supplement her. I let her stay on her mother too long and she wasn't getting enough to eat. Found her on a day like today, just almost comatose asleep. I was able to save her and she was a little bit older, but you may notice them curled up sleeping a lot. One thing to look for when your babies get up is make sure that they stretch. If they're not doing that nice stretch when they get up, then they might be too cold. Again, it doesn't hurt to put your finger in their mouth and check while you're out there to see if their mouth is warm, make sure the ears aren't cold. In severe cases, you're going to find them comatose like I found mine. The causes is usually not eating enough, so their blood sugar drops. Other things that can contribute to it is inadequate shelter. If they get wet or extremely cold temperatures, which has been common this year. The treatment is going to depend on the severity and the age. So lambs and kids that are older than 5 hours with severe hypothermia will need their blood sugar raised before warming. And the way that I understand this, and Dr. Fletcher could probably explain it a lot better, especially since the information I got was from OSU. And I do encourage you to go read up on that before you put anything into practice concerning this, is that if you've got to raise their blood sugar before they warm up, otherwise some severe symptoms can happen to them. There can be complications when they're warming up if you don't do that. So the age and what you do is critical. So if you call your vet in this situation, they're probably going to want to know how many hours old that kid or lamb is. So if in mild situations, if they're wet, you want to dry them off. You can bring them inside, put them in front of a wood stove, a fireplace, a heater, wrap them with warm water bottles. So don't put warm water bottles directly up against an animal's skin. You want to put it in a hand towel so that it doesn't burn their skin. But you can put that in there, some extra warming. You can place it in a warming box. I know some people will put them in bags and give them a warm water bath. Just be very careful with that. One, you do not want to re-wet the animal. Two, you want to make sure that water's not too hot, but that it actually is warming them. So that one might be a little bit more risky. Raising the blood sugar is an important component of this. So if you want to do this first, if the baby is older than 5 hours, and we're talking newborns here too. But if it's over that 5-hour mark and the temperature is less than 99 degrees Fahrenheit, you can accomplish this by tube feeding colostrum if it's able to hold its head up. Another option would be giving Caro syrup, because it's we use that a lot in other animals to raise their blood sugar quickly. And then another more advanced thing that you could do would be an intraperitoneal dextrose injection. If you have the dextrose and you are skilled at that, then that is going to be an option for you. For most beginners, they're probably not going to want to touch that with a 10-foot pole. But that would be something your vet would likely do if they were treating it. Prevention is very important. So make sure that you have adequate shelter, that nobody's being excluded from the shelter, especially when you're dealing with goats. So you can have bullies and they might not let everybody in. Make sure that is not the case, especially during lambing and kidding. Make sure all babies consume enough colostrum and continue to drink milk. Babies are born with something called brown fat, which gives them energy when they're first born and helps keep them warm. But those reserves deplete very quickly. That's why we need to get that colostrum into them, so that they have energy and they're able to keep themselves warm. And then once the colostrum is done, then they need to be regularly consuming milk. Housing them with friends is helpful. Even when you have bottle babies, make sure they have somebody else there to help keep them warm. Lamb and kid coats, which we talked about in the first session, they're a good option, especially if you have compromised babies that aren't doing quite as well as others. That's a good option. Heat lamps are an option, but again, those are fire hazards. There are barn fires caused every year by heat lamps. So make sure that you are using the safest option possible, that you are installing it properly. I have backups for my backups when it comes to attaching it and tying it to my rafter or whatever. Make sure whatever I'm tying it to is extremely secure and that there are multiple ties to it in case one fails. But even the safest heat lamp is technically a fire hazard. So be very careful with those. Generally speaking, with heat lamps, the recommendation is to use them until the newborns are dried off, or usually when you have bottle babies, they're going to need the heat lamps for some extra warmth. I've seen people make like hot boxes with them. If those are designed properly and they won't tip over, those may be safer and more effective at keeping your babies warm than just hanging the heat lamp in the corner of a barn. But again, be very, very cautious with those. You don't want to be one of the statistics that has your building burned down because of a heat lamp. Another thing that you may encounter is floppy kid syndrome. So this is a weird one. I've seen farms that have had a huge amount of floppy kid syndrome certain years. And I don't know that it's fully understood, but the symptoms of this one's going to be sudden muscular weakness. There may be some ataxia where they're not walking just right. They're exhibiting some weakness, some lack of muscle tone. The key with this one is it usually affects 3 to 10-day-old babies, and it can look like other diseases. So again, the cause isn't exactly unknown. It may be metabolic acidosis. It could be caused by a bacteria, Clostridium. Again, it's a weird thing to happen. And I have seen it, unfortunately, I've seen it firsthand, but the kid that had it came from a farm that was having issues with floppy kid syndrome. So I was on the lookout for it. So the treatment for this one is sodium bicarbonate or baking soda, antacids. You can give antibiotics, more of a penicillin antibiotic, thiamine. Again, we're back to the thiamine. Severe cases are going to require a veterinarian. And you don't want to feed kids that cannot stand or move. The prevention is kind of unknown because it's not one that we really understand all that well. If you see multiple animals having this, then it's time to get your veterinarian, your small ruminant specialist, get somebody to help you investigate it, try to figure out what's going on, what you can do with it. That's the best advice I can give with this one. Another thing that you may encounter, especially with more with bottle babies, is abomasal bloat. So the symptoms of this one are going to be distended abdomen. Anytime you see a bloat, it's usually going to be a poor appetite associated with that. Pain and death are other symptoms of it. This one usually occurs in bottle babies. So rapid ingestion of warm milk. We talked about feeding cold milk last year. This is one of the reasons, because it slows down how fast they can eat it. Overeating is a cause. What happens? The bacterial buildup. High lactose milk can be a cause. So, for example, if you're feeding calf milk replacer, which is higher lactose, you're feeding calf milk replacer to your lambs or kids, that could cause it. The treatment for this one, again, it's another one with a poor prognosis, but you can give oral antibiotics, pain meds, baking soda, antacids, oil, and a trocar, which are traditional methods for treating a bloat. Prevention is feed milk cold and free choice. We talked about the lamb bar last week. That is one reason why that works, is you're feeding the animals free choice. They're drinking smaller amounts of milk, but frequently. That prevents overeating. You want to slow down the ingestion of milk. You can put probiotics in your milk and make sure that you're feeding high quality species specific milk replacer. You want milk proteins only, like skim milk is the preferred primary ingredient. And if you want to read more on that, the links are at the bottom of the slide. Another thing that you may encounter is going to be pneumonia, especially with the weird weather that we have. The symptoms of that one, especially for bottle babies, it's easy. I feel like it's easier if you know what you're looking for to catch. A poor appetite. So if you have bottle babies, they're going to be reluctant to finish the bottle, or they're not eating at all. If that's the case, get your thermometer out and check for a fever. Because with pneumonia, you're going to see a fever. You may see coughing, labored breathing, nasal discharge, lethargy, or death. This type of symptoms that you see is going to depend on usually what stage you catch it in. So if you catch it early, you might not see all of these symptoms, and catching it early is going to help you get treatment earlier, which will lead to a better prognosis. The causes of pneumonia are usually going to be bacteria. You can get secondary infections like parasites, or previous infections can make the animals more susceptible. Environmental conditions can contribute to it. So overcrowding, sanitation, inadequate housing, poor ventilation, weather changes, and then stress is also a cause of these types of things. It's usually diagnosed based on the symptoms, but you can get a culture done. Work with your vet to get a culture done. If you find a dead animal, you can have a necropsy done. There are state labs. There's 2 state labs in Maryland with the Department of Agriculture that perform necropsies. So if you are in a situation where you find an animal deceased and you really don't know what happened to it, that is an option you can check with a necropsy. Treatment for pneumonia is going to be antibiotics. You need to consult with your vet to determine the most effective antibiotic, the dose and duration. And then supportive care can include anti-inflammatories, fluids, and probiotics. For prevention of this one, good nutrition, adequate and clean housing, proper ventilation, and reduce stress, especially if you're shipping. The good thing with Facebook is you can find anything that you want now. Follow people's farms, which makes you more likely to ship animals. But you want to make sure that those who are transporting animals are taking proper care of them, and making sure they reduce the stress as much as possible. If you're transporting them over long distances, make sure you're reducing that stress as much as possible. Don't do too many things to your babies at once. That's going to give them a lot of stress. So you don't want to wean, castrate, and vaccinate the same weekend. You don't want to put too many stressors on them all at once, especially when they're young. Another one that people will see in young lambs and kids is going to be white muscle disease. This is caused by a lack of selenium and or vitamin E. It could be that they have plenty of selenium because you're feeding them a grain that has it in it, but they're not getting vitamin E because they're not out on pastures. So if they're not getting the vitamin E, the two of those go hand in hand. If you're missing the vitamin E, then you're going to be selenium deficient. Many areas in the US are selenium deficient. Forages and grains grown in these areas may have little or no selenium in them. So you also might see that multiples are more likely to be selenium deficient at birth. Stress can also cause older lambs and kids to develop white muscle disease. It affects the heart and the skeletal system. The symptoms you're going to see is stiffness, muscle weakness, and sometimes this can be present as a newborn. Um, if the animal's not getting up or can't hold its head up or its legs seem weak, this is one thing that I would explore as a possible cause. They have trouble moving around, or you see them start to lose weight. A humped back is a symptom. Dead or weak newborns can be a symptom of this as well. The treatment's going to involve an injection of both. So it's like common drug that's used that contains selenium and vitamin E. You're going to need to get that from your vet. It treats symptomatic lambs or kids, weak newborns, and usually it requires an additional injection in 6 weeks. So if you are concerned about this, the possibility of having this, or you have had it, this is a conversation you want to have with your veterinarian to have the treatment available on hand and instructions on how and when to use it when the time comes. For prevention, you can have blood samples taken to check your selenium levels in your herd. Too much selenium is also dangerous. So just because we're in selenium deficient areas doesn't mean that we're throwing all kinds of selenium in their diets, because too much can be a problem too. So we don't want to go overboard with it. Keeping loose minerals available for dams at all times can be critical. So you want to check the levels in the minerals. You also want to check to see if there's vitamin E in it. That's another reason to use loose minerals as opposed to a block, to make sure you have the vitamin E in there, especially if you have animals in confinement, which usually around lambing and kidding time, they're going to be in confinement. For selenium, you can feed a grain with minerals in it. I think I've only come across one grain that actually had vitamin E in it. I have seen a grain with vitamin E in it. So you really need to check those feed tags for that. Usually you're going to see selenium in commercial sheep and goat feed mixes that are mixed for your area if your area is selenium deficient. If you have a custom mix, you want to make sure the minerals are added to it or that you're supplementing those. Ensure that your newborns are getting adequate colostrum. Again, we're coming back to that colostrum. So hopefully you see how important it is by the time we get done that newborns get colostrum. Ensure they get adequate colostrum from dams that have been supplemented with selenium, and work with your veterinarian for preventative protocols if you are having problems with it. Starvation is something that you may encounter. It can occur because they're not eating for various reasons. There could be multiple reasons why a lamb or kid's not eating. Some of the causes may be that they're cold and you kind of got to force them to eat. They've gotten a little bit chilled. We talked last week with bottle babies about dumb lambs and kids. Starvation is a legitimate concern with them. Diseases or injuries may cause them not to eat. So that could be a disease or injury on the lamb or kid, or it could also be on the dam. So she may have mastitis. She may have sore mouth and her udder hurts, her teats hurt. So she doesn't want them to nurse on. There's different reasons. So if mom's kicking the babies off, go to check out mom to see if there's something going on with mom. Sharp teeth can be an issue. So if you see sores on the back of the dam's teats, check those babies for sharp teeth. Because once they start making mom sore, then she might not allow them to nurse anymore. You could have bad moms, or the babies get straight up orphaned or rejected. The treatment for this one is correct the problem if possible. So if it's a chilled lamb or kid, warm them up. If they have sharp teeth, they make little files that you can file the teeth down so they don't have a sharp edge on them. You can help the lamb or kid find the udder. If all else fails, you're going to bottle feed it. Treat any infection. So if mom has an infection, you're going to need to treat her, possibly supplement the baby while she's being treated. And then tube feed or bottle feed the baby if you have to. Once you start bottle feeding, the baby might not be able to be returned to its dam Just depends on the dam, depends on the baby. You can always try, but monitor them closely, especially if you've took that baby away from her for any extended period of time. Tube feeding is a skill that everyone, if you are having lambs and kids, you need to learn. You need to be willing to do. We didn't go into this a lot last week because we're talking about it this week. It is necessary when lambs or kids can't nurse. And you're going to encounter them. If you raise enough lambs or kids, you're going to encounter something that needs to be tube fed. This is preferred when the lamb or kid is going to be put back on the dam. I've been able to bottle feed lambs and kids and return them to the dam, but it depends on your operation, your breed, how you interact with your animals. There's a lot of factors that may play into whether or not the mamas take their babies back if you've been bottle feeding them. So it is, a lot of people will go to tube feeding because one, it's a lot quicker than bottle feeding, but two, there's less chance that the babies will not want to return to their mom if you tube feed them. I know people don't like to do this. They feel more comfortable syringe feeding, but syringe feeding is and drenching is extremely dangerous, especially with these young babies. They can aspirate the milk. So tube feeding, when done correctly, is a lot safer. And you also have to realize that if a lamb or kid needs to be tube fed, it's usually going to die if you don't do it. So if you do it correctly, you follow the steps, you're not going to kill it. You never want to attempt to drench them. If they can't nurse, you want to tube feed them. So for tube feeding, you're going to have to gather your equipment, which is usually a big syringe with a catheter tip, a catheter or tube. They sell tube feeding kits, but it is a red rubber, basically a red rubber catheter is what's used. Your vet will likely have that on hand, especially if they deal with cats and dogs. That is the same, it's the same tube. You're going to want warm colostrum or milk, depending on the age of the lamb or kid that you're tube feeding. If they're a newborn, you're going to want colostrum. If they're a little bit older, you're going to want milk. Generally, you're going to measure and mark the tube. You're going to measure how long the esophagus in that lamb or kid is, and you're going to mark the tube because all of them are different. So you may have a little teeny 5-pound lamb that you have to tube feed. Then you may have a 10-pound lamb that you have to tube feed, and the length of their esophagus is going to be different. So that's why we mark the tube. So you may end up with multiple marks on your tube, depending on how many times you have to do this. Hold the animal between your legs, usually in a seated position, and you would gently advance the tube down the animal's throat. I'm not going to go into great detail on it because when you do it, you're going to want to read the instructions. There is an excellent fact sheet that I got years and years ago at one of our extension lambing and kidding schools. And the first time I had to do it, I was completely by myself and I had to get that binder out and read the instructions and just follow the instructions. Dr. Susan Kerr wrote an excellent fact sheet on it, and it gives step-by-step instructions. And if you follow those instructions, you should be completely fine. It is very nerve-wracking the first couple of times, and if you lose the animal, most likely it was probably dying anyways, especially if you're following those instructions. Premature lambs and kids can also be a problem. Just recognize that sometimes they're just too young to save. If they're born too early, no matter what you do, you might not get them to survive. You want to check for a sucking reflex. If they're able to suck, you want to give a feeding of colostrum. If they're able to walk and stand and nurse, they may be able to stay with the dam. You just need to put a coat or another heat source out there for them. If the babies don't have a sucking reflex, you may need a dextrose or glucose treatment and then to feed them colostrum. For preemies, you want to keep them warm. You may have to bring them in the house, put them in front of a wood stove or a fireplace. If your house is cold, then you may need to put them under a heat lamp, even in the house, or like a warming pad. You want to feed them small amounts frequently, at least every 2 hours. And you may have to swaddle them. That lamb in the picture actually stayed with me for a few weeks at work because he was so tiny. He was probably a week old in that picture and still extremely tiny. I did have to swaddle him. He had some major sensory issues when he was first born and he screamed. So I would wrap him up tight and let him go to that was the only way he could sleep. Um, so they can be a little challenging. They can also be very rewarding. He had a few health issues as he got a little bit older, but then he grew out of them and became a nice, healthy wether. Um, so sometimes you can save them. It takes a bit more patience than your standard bottle baby sometimes. Birth defects are another thing that you may encounter. Some mild ones would be like parrot mouth, where you have a big overbite or an underbite. Um, in those situations, they may be able to lead a normal life, but you shouldn't use them for breeding. You may encounter a crooked face. I've tried to save a crooked face in college on the research farm. It didn't work. I kept her alive about a week and then lost her. If an animal is born with extreme face deformities, they usually don't live if they're born alive. The picture is an extreme deformity. There are cases of missing anus, and this one is more common than you might think. For females that are born missing the anus, they might be able to poop through the vagina, but it usually ends up being fatal. I've seen the cases that I've seen, they were able to keep them alive for, a few weeks, maybe even a month or so, and then something happens. They usually end up losing them. But this is one that I never thought I would check for, but now if anything seems off, I check to make sure that all the correct holes are there. Extra limbs can happen, and you can have deformed stillborns, like in the picture. Animals with mild defects may be able to lead a normal life. You could use them as pets or meat animals. Animals with extreme defects should be euthanized. And just keep in mind, when you lose them, if you think that it's a mild thing, there could be more going on inside than what you can see. So don't be too hard on yourself if you try to save them and you lose them. Constipation is something that we may see in younger animals. If it's an older animal, especially an animal that's not on milk, and somebody says it's constipated, then you want to go to the first goat 911. We talk about urinary calculi, because urinary calculi is a lot of times mistaken for constipation. But for babies that are on milk, this constipation can happen. It's usually a problem in newborns that didn't pass their meconium. So if they didn't pass it, then you might need to treat them for constipation and get them to pass it. The babies can become dehydrated and cold. The symptoms are going to be weak, inactive, cold mouth, not wanting to eat below normal temperatures is usually what you're going to see. For treatments, you can get out your trusty tube feeder. That can work for both. You want to give an enema. You can give an infant enema, or you can give a warm soapy water enema. You can use that red rubber catheter and a catheter tip syringe to do that. You want to keep them warm, monitor the rectal temperature until all the meconium is passed and the baby is eating and able to maintain a normal temperature, and then feed them. Lice is something that you're probably going to encounter if you have a barn of any size around here. They're blood-sucking external parasites. Young kids are most vulnerable to them if they're a problem in your barn. The symptoms, usually people say their goats have fleas. And as soon as they say fleas, I know they have lice. So they're small flea-like parasites that are usually found on the top of the head. You might find the babies itching their head. If you disbud your babies, then you might see the lice a lot sooner when you go to shave the hair off before you disbud them. Their hair coat can become rough. They might rub or itch. They might be missing hair, and they can become anemic if it's a severe problem, especially on the younger lambs and kids. The treatment's going to depend on the age. You can treat the dams. Older kids or lambs, you might be able to put a topical treatment on it. Probably the safer thing, especially with the younger ones, is to use a flea comb and comb the lice off. For prevention, lambing and kidding in colder months or on pasture might help in treating your premises. Another problematic thing that you may encounter is going to be sore mouth. This is a contagious virus. It is zoonotic, which means that you can catch it. If you have a cut or a sore on your hand, or you touch the animal that has sore mouth, and then you touch an area of you where you have a wound that you might not be aware that you have, You can catch it, and from what I hear, fortunately, I've never gotten it. From what I hear, though, it is extremely painful. So it's not something you want to catch. The symptoms are going to be bumps or blisters, usually around the lips and mouth, and they can be in the mouth or throat for our lambs and kids. Their moms, if you see that on your lambs and kids, check the mom's udder. Usually you're going to see some blisters on the teats, and she might not allow the babies to nurse if it's painful. Babies with severe cases around their mouth may refuse to eat. The treatment for this is there is no treatment because it's a virus. You have to let it run its course. Usually it's going to take a few weeks. In severe cases, there are vaccines available. If the baby is not eating, then you're going to have to intervene. So if the problem is that the mom's not allowing it to eat, then you're going to have to bottle feed. If the baby's in a lot of pain, then you may have to tube feed or ask your vet about pain medication to make it less painful so that it will eat. And then there's something called ADR in the veterinary world. That just means ain't doing right. And usually this is what you're going to see is, I don't know what's wrong with my baby. It just doesn't seem right. And that is perfectly valid reason to call your vet. If you can't figure it out, you can call your vet. It could be a situation where the baby's having a bad day and you can still get it to eat. It seems to be doing okay. It's not running a temperature. And then the next day it's fine. That does happen, but no matter what, you need to monitor them very closely. Gather as much information as you can. Take the temperature. How much is it eating? Is it eating? Does it have diarrhea? Check all the major things. Contact your veterinarian. The more information you can give them, the more likely it is that they can give you a diagnosis more quickly, or actually get you a diagnosis. And sometimes your peace of mind does have a price tag on it. It does cost money to take your animal to the vet, but sometimes it's worth it just for the peace of mind, especially if it's an animal that you're very attached to or an animal that's very valuable. So when we're looking at lambs and kids, it's important to know what the healthy ones look like, especially when you're first starting out with them. So for healthy lambs and kids, they're going to be generally clean. So no, when we're talking about clean, we're talking about dirty tails usually. So you're not going to see evidence of diarrhea. They've been having healthy poops. Everything's working properly. They have a healthy appetite. If it's a bottle baby, you give it the bottle, it takes the bottle right away. You see it if it's nursing from its mother, you see it nursing the mama. Everything's going well. You see it peeing and pooping normally. The newborns have passed their meconium. They're active, they're running, they're playing. Usually they get to be a couple of days to a week or so old. They start running and playing. With the lambs, I call them the lamb races. Goats like to jump up on stuff. The lambs have races. So they're participating in their lamb races. When you see them get up, they're doing that nice healthy stretch that we like to see. Sick lambs and kids, diarrhea is going to be a major symptom for a lot of them. They're reluctant to eat, or they don't quite finish the bottle when they were finishing it the day before with no problem. They're standing hunched in a corner. You hear them crying or vocalizing a lot. Heavy breathing or rapid breaths would be a concern. A distended belly, pale mucous membranes is one that we do not like to see on any age animal, but it can be concerning on lambs and kids as well. So some general tips: make sure those newborns get adequate colostrum. Make sure that you're dipping the umbilical cords when the babies are born. Take a rectal temperature when animals are acting not quite right or sick. Provide good minerals for your pregnant and nursing dams. Keep your lambing and kidding areas clean. Have that tube feeding equipment and the instructions necessary available for you. Ensure that all your babies are getting enough to eat at all times. And then if you have to, go ahead and bottle feed them. Like we said last week, fed is better than dead. So I'd rather have a bottle baby than a baby that gets starved to death, or is way far or lags behind all the other babies because it wasn't getting quite enough to eat from its mother. Some cautions: it should be rare that you encounter most of the stuff that we discussed, because they can be prevented with good management. If you're experiencing a high number, and a high number could be just one animal if you have a small herd, but you're seeing a high percentage of your animals experiencing the same issues, contact your veterinarian or an extension specialist to look at your farm, look at your management, look at your feeding program to see if there's something not right that can be corrected and stop the problems from having that you're having. Many states do have animal health diagnostic laboratories that can perform necropsies, which can tell you a lot about, especially if it doesn't make sense that an animal has died. These are usually done fairly low cost for people who live in that state. So that is an option that's worth checking out. And they will usually send your results to your veterinarian. They can work with your veterinarian to make sure they get all the information to them. So that is an option if you're having any issues. And I will be glad to take any questions if you have them.